Hello, everybody. This is Dr. Sanaa Youssef. I hope you are all safe and sane wherever you are. It gives me a great pleasure and really a privilege to be with you speaking about this very important topic, which is the immunity in inborn error of metabolism. I eventually gave it the name of my presentation, the 3M shield for inborn error of metabolism. What are these three shields? The immune shields are through the first shield is the macronutrients, the second shield would be the micronutrients, and the third shield is the microbiota. So here are the 3M. Macronutrients would include the proteins and carbs and lipids, while micronutrients will include vitamins and minerals. Microbiota, of course, we mean what we call them the probiotics, and they need always the presence of prebiotic for the proper function, being the food for the good beneficial bacteria in our GIT system. We start first with the first M, which are the macronutrients. What does it include, the macronutrients? We said it will include A, B, C, A for protein, and the deficiency of dietary protein or amino acids is very well known to impair the immune function and increase the susceptibility, of course, to infectious disease, because all our antibodies and complements, they all come from the proteins. Now, amino acids, they have a role in immune response, and they regulate, number one, the activation of the T and B cell lymphocytes, the natural killer cells, and macrophages. The second function they have a cellular redox state. They are responsible for it, as well as they are responsible for the gene expression. And the third step would be the production of antibodies, which we just mentioned, cytokines, and other cytotoxic substances to kill the invading infectious agent. Now, what are the most common metabolic disorder, protein metabolic disorder? We have the phenylketonuria, comes on top of the list, especially in my country. And then we have the maple syrup disease, which is also comes on top of the list in certain Arab countries. And we have the isovaleric acidemia, glutaric acidemia, propionic, and methylmalonic acidemia. The offending protein in case of phenylketonuria, as you all know, is the phenylalanine, while in MSUD, it is the branched chain amino acid, such as leucine, isoleucine, and valine. And in isovaleric acidemia, it is again the leucine. In glutaric acidemia, it is the lysine and the tryptophan. And in case of propionic methylmalonic acidemia, it's the threonine, isoleucine, valine, and methionine. What happens, we'll just discuss very rapidly, what happens to the immune system in the most common ones. In case of phenylketonuria, when you are going to have accumulation of the phenylalanine, this is going to hinder the regulation of the BH4, which is responsible, it is a cofactor for nitric oxide synthesis, which is very important in certain chemical reactions for the brain development. At the same time, the tyrosine, which is very important for the brain, it is very much decreased in its level, and it was responsible for the synthesis of the neurotransmitters, so we do not have proper neurotransmitter function. Now, coming to the MSUD, the branched chain amino acids are responsible for the regulation of protein synthesis, activation of cytokines, and also the antibody production. And accordingly, the accumulation of the branched chain amino acid at the same time will result in a decrease in the glutamine, which is the major fuel of the immune system for the regulation of T lymphocyte proliferation, as well as cytokine and antibody production and activation of the macrophage function are going to be all lost. Coming to the propionic methylacidemia, Eventually, we have here the accumulation of 3 amino acids, which is the threonine and the isoleucine, the valine and methionine, and they are to hinder the synthesis of the mucin protein, which is responsible for the intestinal immune function. And as it is very important, 80% of your immune system resides in your GIT. So we have a big problem here with our GIT. And also, what if eventually happens in this case is that in cases of glyceric, so this would going to affect the GIT function. In the isovaleric acidemia, we have the accumulation of the leucine, which was responsible for the regulation of the immune system. Tyrosinemia, which is a common disease, eventually the the defective would be in the accumulation of the tyrosine, and this is going to result again affection of the proper brain function as it is needed for the tryptophan and for the formation of brain function. Glutaric aciduria, we have the lysine as well as the tryptophan accumulation, and they were responsible for the formation of nitric oxide and antiviral activity, and also for the neurotransmitter and the inhibition of the production of inflammatory cytokines and superoxide. Eventually, what happens in this, there is a stage in the middle of the cycle of these amino acids, which is going to result in the accumulation of glutaric acid, 3-beta hydroxyglutaric acid, as well as gluteryl transferase transcarnitine. They are going to accumulate, and this product which accumulates eventually will result in a very serious condition, which is the affection of the basal ganglia of the brain, and also the white matter changes can occur. So usually patients would present with CNS manifestations. In cases of the homocystinuria, we have the methionine, which accumulates, and this methionine is supposed to play a critical role in starting the process of making new proteins inside your cell. The homocystinuria, when methionine accumulates, and during its cycle, is going to eventually affect the 4 main organs. Unfortunately, it affects the eye, it causes lens retinal detachment, optic atrophy, as well as cataract, and it affects also the bones, which is really serious, and it causes severe deficiency rickets, which is exactly like the end organ resistant rickets. It makes patients shorter, and it affects the CNS as well as the vascular thromboembolic, and it results in pulmonary embolism and ischemic heart diseases. Then we come to these were I chose eventually the most common metabolic protein disorders in our region. The amino acids, although they are very important and they are key, they regulated the key metabolic pathways of the immune response and resistance to infectious pathogen, and an adequate dietary provision of all amino acids is necessary for sustaining the normal immune competence and protecting the host from a variety of disease. But unfortunately, there are certain amino acids which should be completely prohibited in certain disease. And so this is compensated for either by a not too restrictive diet, protein containing, or through a formula which is well balanced with the protein needs, provided that we give it in the proper amount and in the proper concentration. These are the options for management of the immune deficiency, which results from the proteins. The second category of macronutrients would be the fats. We know we have animal fats and we have fats of vegetable source. The cooperation between the cells of the immune system is usually through a combination of associated events such as the secretion of lymphokines and antibodies, antigen receptor, lymphocyte transformation, and contact lysis. Lipids play a very important role and a major one in the maintenance of the cell membrane integrity. The integrity of any cell in your body depends on lipids. And this highlights how lipids are critical nutrients in the regulation of immune function. Now, the lipids, dietary lipids, influence substrate availability in the formation of cyclooxygenase and lipooxygenase products, which act as lipid mediators in the control of the immune system. Whenever any organ is attacked, the cells of this organ, they start to release the immune function, the immune, the lipids which are within the cell wall into this organ, starting to protect it and to fight back the infection. So if the cell membrane is not properly and well maintained with the lipids, then we have really a problem. Omega-3 and omega-6 are very well known as to be as essential fatty acids. They are a source of energy, and also they play a role in the tissue development and the protection of healthy tissue through the protection providing a healthy cell membrane. Omega-3 is known as the alpha-linolenic acid, or ALA, and through certain enzymes which are known as desaturase or elongase, they go into the eicosapentaenoic acid, the APA. Now, this APA is further acted upon by certain enzymes to produce the DHA. DHA, when the cyclooxygenase and lipooxygenase, they act on it, on the membrane structure, it is released into the organ and it produces minimal inflammatory or inflammation resolving or anti-inflammatory eicosanoids, resolvins, and protectins, which are going to fight back the infection. So they are eventually very important. The omega-6 is also responsible for the energy and for the tissue health. And it is known as the linoleic acid, the LA, and it is usually metabolized into arachidonic acid, which is known as the AA or ARA, and through the cyclooxygenase or lipooxygenase. If we reach this step, then we have the pro-inflammatory, the cell the products such as the prostaglandins, leukotrienes, and the thrombokines. And these are very potent signaling molecules for the inflammation and infection. The DHA is very important eventually because what happens is that EPA, the eicosapentaenoic acid, is going to block omega-6 downstreaming the conversation. It stops it at the level of the AA, which is needed for immunity, and it does not further into more metabolization to produce the pro-inflammatory cells. It's all about a balance, the balance between the omega-3 and the omega-6. Very, very important. And the cell membrane contents of phospholipids is very important to have a balance of 1 omega-3 and 3 and 4 omega-6. You will be amazed. Why? If I increase the concentration of the omega-3, not too much of everything is beneficial. if you look at the pink table, you will see that an excess of omega-3 is going to alter the membrane composition, increases the membrane fluidity, and there is loss of the microbial immunity, a decrease in the macrophage function, a decrease in the cytotoxic lymphocyte activity, a decrease in the natural killer cells, decrease in the pro-inflammatory cytokine production, decrease in lymphocyte proliferation, decrease in neutrophil and the monocyte chemotherapy. So not too much of everything is beneficial. On the other hand, if you have too low omega-6 in response to the very high omega-3, you will have an impairment of the brain function development and increased risk of cardiovascular diseases, hypertension, infertility, visual acuity, growth retardation, and scaly or hemorrhagic dermatitis, and with impaired wound healing. So we are speaking here about a proper balance to keep a proper functioning immune system, which can support us and defend us. Now, we have the fatty acid oxidation diseases. The tissues and the cells that rely upon the fatty acid oxidation are the heart. It takes 80% of the basal energy demand from the fatty acid oxidation. The liver, which needs to provide acetyl-CoA for ketogenesis and ATP to support the gluconeogenesis. The skeletal muscle depend also on this oxidation for ATP to support the exercise. Type 2 pneumocytes, the ATP to support the surfactant synthesis in newborn. If these diseases start from early in the neonatal period, you might have a problem with the respiratory system. So coming to the T cells also, the differentiation and T regulatory cells, they depend on the fatty acid oxidation, and accordingly, this is a very important step for the immune function. And the renal proximal tubules, they depend on the ATP to support the solitary absorption and ion transport. So fatty acid oxidation is very important. The connection between the fatty acid oxidation disease and the immune system is twofold. Whenever the fatty acid oxidation is blocked, we have the accumulation of acylcarnitine, which is going to activate the central regulator of the inflammatory response, known as the nuclear factor kappa light chain, and enhance of activation of B cell. Thus, it drives the secretion of pro-inflammatory cytokines, or you go to the side of many inflammatory, allergenic, and metabolic diseases. Also, the memory T cell and the regulatory T cell, which are a very important function for the immune system, which regulate the immune system, they rely on the fatty acid oxidation to meet their bioenergetic demands. So you see how important they are. In my take-home message, I would like to stress on the importance of fats, in the most important, the healthy fat, and in a proper ratio, the essential fatty acid. Fatty acid oxidation patients, although we usually rely on the medium chain triglycerides for them, yet 10% of their dietary calories, they have to come from long chain fats to maintain the normal essential fatty acids also, and may need the essential fatty acid supplementation if the level is too low. But, and because it is crucial for the brain and the immune function. But if you have a formula which is very properly balanced, then you don't have a problem, neither with the long chain fats, neither with the MNCT fats, and accordingly, patients who receive a well-balanced formula, such as the monogen, as the sole source of nutrition, they do not carry the risk of essential fatty acid deficiency, as because it is there in the formula. Coming to the carbs, What are the carbs? Carbs are dietary fibers or the complex carbohydrates, because we have the simple carbohydrates, which are the sugars, and they are really serious. The sugars by itself, whether in healthy patients or patients with inborn error of metabolism, causes a severe dysregulation of the immune system, combating immunity through many mechanisms. One of them is through the fact that they are going to deplete the cells from vitamin C, and sugar goes inside the cells of your body, replacing the vitamin C, which is very crucial for your immune function. Also, sugars are going to change the gut microbiota, because sugars are the best source of food for all pathological viruses and bacteria. They need it for their food, as their food, and they need it for their function. So depriving them from them keeps the balance of a good immune system. It also acts through the function of the macrophage. Too much sugar is going to lead to a real serious problem in the macrophages, and it will not be able, the white blood cells would not be able to perform their function, whether for adhesion or phagocytosis. So you need to be away from the sugars in even healthy persons. So the complex carbohydrates are mainly the food for the good bacteria, and they are undigestible to the host. Diet composition, as well as changes in the gut microbiota, they profoundly impact the immune function. And the vast majority of immune cells, as we said, 80% are present in the GIT, the tall cell, the dendritic cell, the M cells, the Peyer's patches. All these cells are present in the immune system. So microbiota accessible carbs, we call it now the MSC, they present the major energy source for the colonic bacteria. It is their food. They need it for the proper function. And most important, they need it to produce their byproducts, or the postbiotics, which are known as the short-chain fatty acids. Short-chain fatty acids such as the acetate, propionate, and butyrate, many acids, they are usually released in the GIT following the fermentation of the complex carbs, and they elicit numerous effects and function and hematopoiesis of the dendritic cells, and they keep the balance for a good immune function. They have a broad impact on the T cells through the dendritic or tall cells, and by directly promoting the differentiation of the naive T cell into regulatory Th1 and Th17, and indirectly inhibiting Th2 differentiation, which takes you to the pathway of allergic disease. Th1 takes you to the pathway of autoimmune diseases, and it is again the balance between the Th1 and Th2, which keeps a good T cell function. And this is again regulated by the good microbiota, which need good microbial accessible carbs. This picture is just to give you an idea how a low dietary microbiota accessible carb is going to affect the integrity and affect the function of your GIT. Now, having no carbs or very low carb is going to affect the bacterial diversity. As we said, it promotes more the presence of the harmful bacteria and less of the good bacteria, which we call the dysbiosis, or the imbalance between the good and the bad microbiota. And it increases the mucus degrading bacteria of the mucus, and it decreases, there is a decrease in the macrobiota accessible carbs and degrading the good bacteria, and it decreases the mucus thickness, which was like a trap, which was like a net present above the cells of the GRT, trapping the bad bacteria or the invasive pathological one to keep them away from passing through the cells and causing a low-grade inflammation or an inflammation. But eventually, when you have the short-chain fatty acids are decreased, they are not produced anymore, or recently we call them the metabiotics or the postbiotics, you will have a disturbance in the immune function of your GIT. Disorders of carbohydrate metabolism it is very well known that glucose is the main substrate for most metabolic processes in our bodies, whether we are, even when we are healthy. And the breakdown of stored glycogen results in rapid release of glucose, which preserves a constant blood glucose concentration. As an example of the disorders of the carbohydrate metabolism, the most common one and the most prevalent are the glycogen storage disease, specifically glycogen storage disease type 1b, and this exhibits a congenital neutropenia and neutrophil dysfunction, and glycogen storage type 1b is the only inborn error of metabolism that is officially listed as a primary immune deficiency disease according to the International Union on Immunological Societies and Expert Committee of Primary Immune Deficiency Diseases. Now, the take-home message for the carbs you do. Macrobiota accessible carbs play a pivotal role regulating of antibody response, both locally and systemically. It has an effect, also a systemic effect. And if they are deficient, a diet deficient in the macrobiota accessible carbs has a defective homeostatic and pathogen-specific antibody response. So it is very important to keep the good carbs much enough and the bad carbs away to keep the balance and to keep a healthy gut. Then we come to the micronutrients. Of course, you all have an idea about the micronutrients. They are further subdivided into vitamins as well as minerals. The vitamins, we have three main vitamins we will tackle. The first one is the vitamin C, and here are the sources of the vitamin, natural sources of vitamin C, and how the content of vitamin C in each. So you have a big choice whether you need a high dose of vitamin C, or if you have a supplemented formula, would you like to complete it with the food, or you need a high supplementation from the food, and if your formula is not available, or you have a mild access to this food, then you will need a supplementation of the vitamin C. Vitamin C is very well known to be an antioxidant, so it removes the rust, and it keeps your cells healthy, and it protects them from aging, so they are properly functioning. And it boosts the immune system and the strength and defense by so many mechanisms. There are too much to be tackled here, but it is very important to know that vitamin C has an antiviral and antibacterial and anti-inflammatory properties. So it is very important to supplement our patient of inborn metabolic diseases with vitamin C. The second vitamin I would tackle is the vitamin A. Vitamin A is of utmost importance, as you all know, to the immune system. We have, and these are the examples of the dietary sources of vitamin C. It's very simple. You see how the parsley, which is a very simple plant, has a very high content of vitamin C, followed by the sweet potatoes, and followed by the spinach, and the spinach, the carrots, and also the mushroom. So you have to be sure that you are giving enough vitamin C, and you have to be aware of what you are giving to your child. Sorry, the vitamin A. Vitamin A and provitamin A helps a better functioning of the immune system and cells, immune cells, and immune complex. What happens is that vitamin A boosts the function of the natural killer cells. It helps the phagocytosis. It helps also and supports the good function of the B cell and T cell, as well as it produces interferon. So the whole cycle together is going to give me support my immune system, and vitamin A is crucial. When you supplement infants with chest infection normally or with vitamin A, they have a better outcome. So this is an example how it fights the infection. Patients with respiratory disease, usually in the world, we supplement them with boosting their immune system with vitamin A and C, and this usually shortens the duration of the disease. Special vitamins which are needed for patients with a very inborn error of metabolism are the B6 and then the B12. B6 is essential for the production of antibodies, interleukin 2 and 4. It is also very essential for the normal function and preventing the inflammatory condition. And B6 is usually present in the whole grains, in the banana, and in the avocado, and is also present in the here are in the types of fish. So this is very important, and you have to go to it to supplement and support your patient. B12 stimulates the T cell development, restores abnormally high CD4 to CD8 ratio, which is very important, and retain normal lymphocyte count. It's present in the eggs, in the sardines, in the liver, and again also in the mushroom, as well as it is present in the cheddar cheese. So you have to supplement your patient with a well-balanced proportion, and if it has to be restricted, you have to count how the restriction, and you need to supplement the difference, or whether it was an oral supplement or through the formula, which is very well and fully balanced. Coming to the minerals, we all know about the importance of minerals, specifically the iron, the zinc, the calcium, magnesium, and potassium. Iron plays a very, very important role in the immunity. It improves the immune attack on the bacteria. It stimulates the T cell proliferation, and it leads to a normal cytokine production. It has 3 mechanisms to fight back the infection, and diet resources are very available. You have the dried apricots, again the liver, the parsley, and some of the types of the nuts, especially the pistachio. Zinc and the immune system. Zinc is very important for the growth, for the multiplication of every cell in your body, and also for the immunity. Even the brain needs zinc. So zinc is very important in many situations. Concerning the immunity, it is essential for the normal growth of the immune cell. Zinc is an element which is responsible for multiplication of any type of cell in your body, and it plays a crucial role as a cofactors in many of the chemical reactions in your body. It is also crucial for cytokine production by the monocytes and important for the acquired immunity, whether the number of the T cells or their function. And it is also important for the innate immunity, and through the phagocytosis and the natural killer cells, which are the very simple cells present in your immune system. We have to remind you that the innate immune system is there from the start of our life till the end of life. The acquired immune system is a plus, which is needed when the innate immune system cannot anymore fight back. He calls for the support of the acquired immune system, and this is how they function and they boost our immune system. Zinc is very well known to be present in nuts and in the meat. Red meat, is the best source of iron and zinc, and it is also present in the sardines. It is present in the oysters, the highest content of zinc in oyster, but we cannot give it, of course, to children, but it is there, and also in the cheddar cheese. So my take-home message for the minerals and vitamins. Minerals and vitamins should be supplemented to all infants with inborn error of metabolism to boost their immune system and support them back. Either it is taken through the restricted food and vegetables, such as vegetables and fruits, or taken through a formula. If neither of them is not available, then we need to supplement them as a medicine in the required amount. The gut microbiota is the last shield. It is the most important shield because it is the key player for all what we mentioned before. What happens in the gut microbiota? Now, this is your GIT. The human gut is a metabolically rich environment, and it harbors 3/4 of your body immune system. And it is also considered as a second brain with very, very high nervous connection. We have the enteric nervous system, we have the vagus nerve, we have the autonomic nervous system via pathways, and all these that go to the spinal cord via pathways. It is directly connected to the brain, and it is a bidirectional relationship. What happens in the brain affects the GIT. What happens in the GIT also affects the brain. So this bidirectional relation has to be kept healthy and sane. And what eventually happens is that the vagal afferent endings, which respond to the immune cells and immune and bacterial products, has receptor for the compounds produced by the neuroendocrine cells. And the human gut plays a major role in the development of basic physiological system, digestive system, immune system, nervous system, and constitutes a virtual metabolic organ of unquestionable importance. Now, maybe one day it will come that we say that eventually the GIT is the only organ, and all the other organs are parasites living on the human GIT. So you have to treat it gently and carefully, and you have to take care that it should not cause any disturbance in it. You should not have any disturbances in it. Now, about the diet and the genes, there is a direct relationship between the diet and the genes, and they are both related to the immune system. The immune system is affected by your genes. 20% of your immune system is regulated of the function of the immune system is regulated by the genes. 80% is regulated by the diet of what you put in this GIT. So you have to be tactful enough to back up this organ with all its needs. The gut microbiome, there is a very big variation. It is interpersonal from person to person, that it is sometimes thought to be taken now in spite of a fingerprint, because it is very special to every person. Now, it enriches what do they play? They play a role in the digestion, in the assimilation, everything. And this ends, and the end result is the biosynthesis of cofactors and vitamins. B12 and vitamin K are specifically found there. They are mainly synthesized in the colon, where the microbiota reside, and even you have in the GIT, which is like a factory, which is going to be function or to produce many cofactors, which are important for your immune system as well as for your CNS, because they are directly related to each other. So this depends on the carbohydrates, which are, as we said, the microbiota accessible carbs, the good carbs. This is their food, and we call them usually the prebiotics. Prebiotics are the foods for the microbiota, which are the probiotics. And when the probiotics are going to ferment their foods, they do not, it is not through an enzymatic reaction. They ferment it to produce the postbiotics or the metabiotics, which are rising to the surface now due to the great role they do in our immune system and maintenance of the function of the brain. Maybe one day there's postbiotics that are booming to the surface. They will be the real key players because they contain, as I said, short-chain fatty acid. They contain metabolites, peptides, and even some of these short-chain fatty acid, they help the further fermentation of other cycles, and so the cycle is repetitive and does not stop. So you keep the good balance of your GIT. The gut microbiota are influenced by the environment. What do you mean by environment here? Is it the hygiene only, the accessible to good water supply or healthy water, the good sewage disposable, the good housing? No, the main factor in the environment is the nutrition. Nutrition is the main environmental factor which is going to drive. It is the main driver of your immune system. And because, as we said, the genetics play a limited role, and it is the food which you do, what you eat, it is the real driver of your immunity. Gut microbiota, they go through changes with the stages of life. It is very well known. And in the first year of life, what you put into the mouth of the baby, mainly through whether it is when they are breastfed, and then during the weaning, what you put into their mouth, and then later on in the preschoolers, this puts the foundation for their immune system for their whole life. Would you give them sugar to down-regulate their immune system, or would you give them a healthy diet, rich in fibers, and good carbs, which will boost their immune system? The gut, the major bacterial metabolites, which are known as postbiotic, as you mentioned, have a key role in the colon and physiology and metabolism, and influence the immune as well as the inflammatory responses. Microbiota and inborn error of metabolism. Classically, the inborn error of metabolism are defined as a set of monogenic single gene disease. But it is not always true. We have pleiotropic, which means many gene disease involved, and may involve also many organs or many systems. The treatment of management of inborn error of metabolism are always individualized. You tailor to each case its own nutritional therapy program. And even for the same group of inborn error of metabolism, there are wide variations between each patient and the other one. So there is no white and no black. It is always tailored according to the underlying disease, the subdivision of this disease, its association with other disease, and what is lacking and what we cannot give. So it is very important to be very precise and use what is known as the personalized nutrition here for each case, or it is very important to have what the patient needs and to leave backward what he does not need. The treatment and management of inborn are always individualized based on each patient diagnosis, phenotype, and the broad heterogeneity even within each category. Despite this, in the management approaches, the specific treatment usually falls into one of these three classes only. Either it is an enzyme replacement and to replenish the deficient enzyme, or it is a substrate reduction and a dietary management. Well, a dietary management is always a part of the management, whether with an enzyme replacement, without an enzyme replacement, with substrate reduction, you are coming back to the point of start, which is the nutrition therapy or the dietary management of these disorders. Dietary management for the inborn error of metabolism may be employed as a monotherapy or an adjuvant therapy with the purpose of eliminating, reducing the toxic compounds that is accumulated in the body of these children. However, this form of therapy can lead to sometimes to an overload or a deficiency of certain food groups and nutrients. So from a state of it is going to result in a state of dysbiosis with its systemic effect. But it is usually out of our hands, and we should replenish this by a proper modulation in the nutrition therapy, and this is why the nutritional therapy has the utmost importance in managing and manipulating these patients. Antibiotic therapy, you need sometimes to use antibiotic for these patients, and commonly used in many inborn error of metabolism. And this depletes the microbiome, and again, it is going to result in dysbiosis because you usually kill the good bacteria with the bad bacteria. You do not choose, you kill them both. So this is going to, in turn, affect the level of neuromodulatory substances, such as the tryptophan, monoamines, and neuropeptides, thus influencing certain diseases such as anxiety and cognition pattern. Diet is very important for the memory, for the cognition. It is not only important for just the brain growth. It is important for the development and function of the brain. And each area of the brain has very specific proteins to be needed and very specific vitamins and minerals to act upon them. When you have a too restrictive diet or an overload diet, and on the other hand, you are using antibiotic or other drugs, whatever they are, this is going to affect the nutrients and the metabolites. So how? As we said, they have both a common pathway, and this is mainly through the changes and the modulation of the microbiota and causing a dysbiotic state, and affects of course, there will be no short-chain fatty acid production because they are not produced from the putrefactive bacteria or the pathological one. They are only produced by the healthy microbiota. They can only ferment the fibers or the complex carbs or the prebiotics to give us the short-chain fatty acid. So both of them are going to affect the production of the short-chain fatty acids and are going through killing the good bacteria or the non-pathological beneficial, which was responsible for the fermentation and the production of the postbiotics. Now, coming to the role of the diet with the brain, there is what we call the microbiota gut-brain axis. The microbiota have many axes. It has an axis to the brain. It has an axis to the lung. It has an axis to the liver for the obesity. And it has each group of microbiota are responsible for a certain function. Not all microbiota are the same. We need a wide diversity of many of the good ones to fulfill the function, the access to, they can gain access to all organs to make them function in the best proposed way. So eventually, what happens in the gut-brain axis is the effect of the microbiota on the enteric nervous system. In your GIT resides the second biggest nervous connection after the brain through the enteric nervous system and also the autonomic nervous system. And this is going to affect these systems as well through it's going to affect the humoral system, and in its turn, it is going to affect the brain, whatever the place of the area of the brain, which one would be affected depending on what is happening eventually in the GIT. So you have the brain-gut axis, or what recently we call the microbiota gut-brain axis. The communication between the microbiome and CNS is bidirectional again. What happens in the brain can affect your GIT, and what happens in your GIT, especially the colon and where the microbiome resides, is going to affect the brain. And this is mainly through the metabolites and toxins produced by the bacterial community on one hand, and the immune, metabolic, nervous, and endocrine system on the other hand. Now, I take home message to sum up. Several inborn errors of metabolism are associated with impaired immunity, most often due to their effects on the cellular function. And dietary management is the mainstay for them. And usually, my conclusion would be that dietary management is the mainstay for all these diseases, whether you restrict or you supplement or you are going to provide what is missing. Such in certain diseases, we omit certain proteins, amino acids from the formula. In others, we supplement with certain amino acids to boost what they are lacking. So it's really a very important, and it is a base, and it is mainly the mainstay of this good therapy and the proper management, whether it is single or as adjuvant to all inborn error of metabolism. They need a good nutrition therapy for a good functioning as much as possible immune system, because it is mainly through the diet that your immune system is manipulated, and they provide energy, whatever they provide substrate for the function and for the integrity of the immune system, especially keeping a healthy gut keeps a healthy immune system. And thank you very much for your patience, for your attendance. Hope to see you soon again, and thank you for your time.